Hello, I'm Dr. Elaine Hart Brothers, MD.
And I'm Dr. Michelle Laws, PhD, and we're with the Community Health Coalition.
The vision of the Community Health Coalition is a society where all people live a long, healthy, active life full of purpose and promise. Since our founding in 1989, the Community Health Coalition Incorporated strives with its partners to reach health equity and to eliminate racial health disparities in Durham County and the surrounding areas.
We hope you enjoy the program that we put together for you today. Today we're going to discuss an important health topic that many people find very difficult to talk about: organ donation and end-of-life planning, what we coined at the Community Health Coalition as legacy building. In fact, although African Americans make up about 22% of North Carolina's population, we represent over 53% of persons waiting to receive a transplant, an organ donor. Also, 41.7% of African Americans waiting for a transplant are between the ages of 50 and 64, and 32.6% are between the ages of 35 and 49. African Americans and other ethnic minority groups, including Hispanics and Latinos, as well as Native Americans, also represent high numbers in terms of multiple chronic health conditions that can often lead to the need of a kidney or another type of organ transplant. For example, African Americans have a high rate of hypertension and high blood pressure. We know that Native American population has a high rate of diabetes. And these are two multiple chronic health conditions that, if left uncontrolled and unmanaged, can worsen and ultimately lead someone on the donor registry. As a social scientist, I know that data and facts are extremely important. However, I also know that there are some data that are more compelling than others, such as personal testimonies and life stories. And we at the Community Health Coalition are honored to have with us today two beautiful people who have an amazing story. A couple who's been married for 44 years, Mr. Dennis and Mrs. Roxette Farrington from Chapel Hill, North Carolina. This couple has a story that you won't find very often. It is a story about a wife finding out that she is the perfect match for her husband in terms of a kidney transplant. They're going to talk about their story and share the challenges, share the joys that came along with this journey. So welcome and thank you for agreeing to tell your story and share your story with us. So tell us, Mr. Farrington, what led you down this path to actually needing a kidney transplant?
I come from a family that has kidney problem. And we, in my family, the study found out that we have
MC1 kidney disease.
MC1 kidney disease, and that is an inherited disease from your family.
Mm-hmm.
And it never really bothered me about the situation, for the simple reason my mother had it. I had three aunts. Two are deceased, two uncles that are deceased, and I still have another uncle that has a kidney, and has two cousins that have had transplants. And what made me strong about the whole situation, the one that are deceased and the one that are still living, they gave me strength. So I never got upset. And my wife would say I kind of kept it away from her, but I just dealt with it.
So were there symptoms early on? Because this happened late. This happened last year in 2016. Were you sick? Had you had complications that led you to go in and get screened and have your physician how did you get to the point where they said, you know what, you at this point need to go on the registry?
I got on the registry for the simple reason, like I was saying earlier, my mother and all of them, they had it. And so while working, I took it upon myself to start getting checked. My level stayed at 2.3 for a long time. And depending on your age, when I was like about 59, 58 or 59, it kind of changed. And then 2015, I had a spinal operation. Within that time, about 3 weeks later, I had a sciatica. We had to go back to the hospital, stay another 4 or 5 days. So that put more stress on my
Kidney.
kidney. And then with this beautiful young lady here, she took upon herself she looked at my UNC chart and she kept up with it. She started going me to my appointments. And so that was the time I got on the register.
And so, Mrs. Farrington, for you, did you notice a change in his health condition that sort of caused you to say, you know what, I better take a closer look at this and monitor this? How did it happen for you? So he shared his version of it. What did you start seeing?
Well, actually, like he said, it was about when he was the age of 59 years old. I noticed that his stamina and his sleeping patterns had changed. I also noticed that he wasn't eating like he normally was eating. It was just his physical changes that I noticed. And so I would ask him, I said, well, are you okay? You know, and of course, like he said, he'd always say, I'm fine, I'm fine. And so I decided to go with him to an appointment with his nephrologist. And so when we went to the nephrologist, they told us that pretty soon that he would need to probably think about having dialysis or either getting on a transplant registry. And so at that time, you know, I was thinking, you know, a lot of things could happen where I could lose my husband. And so since I have been married to him for 40-something years, I was able to experience the loss of his mother, his aunts and uncles, and also the sickness that they went through. And so my prayer was always that my husband would not have to go on dialysis. So whenever we found out that his kidney function or creatinine had increased, you know, I said, you know, what am I going to do? And my spirit said that I'm going to do everything that I can to help him because that's my husband and I love him very much. And, you know, it would be unbearable for me to lose him. So I started researching the kidney disease that he had. Again, he said the mucin 1 kidney disease and what I needed to do to help him. So the first thing that I, after researching, you know, I had researched what was a kidney transplant process and what the procedure and what it entails. So the first thing that I knew that I needed to do, since my husband had a rare blood type, which is O positive, I needed to find out what my blood type was. So I didn't know what it was, so I went to my UNC chart and I requested to have the appointment set up to have it done. And so the RN that was on call that day, she called me back and I told her that I wanted to have my blood type taken or measured. And she told me that, well, Ms. Farrington, that your insurance does not pay for it, but if you want to get it really soon and to have it taken care of, what I suggest you do is to go to the Red Cross and donate blood. So that's exactly what I did.
Okay.
I went to have my blood done. And then I guess it was maybe how many weeks? Maybe about 2 weeks later, I received a card in the mail because they send you a card with the blood type and everything on it. And so when I got that card and opened, of course I was praying. I said, oh God, please let me be a donor for my husband, you know, because as a wife who really loved their husband, I just don't think that I could live without him. So I wanted to do everything that I possibly can before I would have to possibly ask some of his siblings. Mm-hmm. And so when that particular card came in the mail, I mean, my husband will tell you, I was in the living room when I opened it up and I was shouting and praising God because I was O positive.
Isn't that amazing? Now, what are the chances of that happening, that a husband and wife, the husband has the rare blood type and the wife is actually also has the rare. But you all have been like high school. Y'all were
Yeah.
high school sweethearts, right?
Actually, mid-school.
Middle
I think I was in
school.
the 8th grade. or
Eighth
something.
grade, since
met.
8th grade. So
Yes.
that's beautiful and amazing in and of
Yeah.
itself. But then you found out you are the same blood type.
Yes. And so I was just so excited that I was, and so I told him, actually he came into the other room because he thought that something was wrong with me, and it was. I was just so happy, and I was crying and thanking God. And so then the next step that I did is that I called the living donor, who is associated with UNC, of course. And I told them that I wanted to be tested to be a donor, and of course we had to have an appointment with the doctor and the nurses first. And so when we went in to have a meeting with the doctors and some of the kidney nurses, and I told them that I wanted to be a donor, I told them actually I was going to be a donor. So I was actually speaking it into existence. And one of the doctors said, well, Miss Farrington, statistically, normally the husband and the wives do not match. And he said that usually it's only 1% that match. And so, I was telling him, I said, well, you know what, doctor, I'm going to be the 2% because I'm going to give my husband the kidney. And so, I guess they really realized that I was really serious about giving a kidney to my husband. And they had also indicated that, that normally they like to match mature kidneys or mature adults with younger adults. And so, I just felt like that I just had to do it so that I could be that 2% to give my husband a kidney.
Right.
And so then we proceeded on with the process of them setting me up to have to be tested. But first of all, Dennis had to be tested, and he had to get on the United network of sharing the kidney. So after he passed all of the tests, because he had to go through a lot of tests as well to make sure that he was a great candidate. Because of course, if he had issues and wouldn't survive the kidney transplant, it doesn't make sense to do it. So I believe it was in February of 2015, no, it was February of 2016, I'm sorry. 2016, it was February of 2016 when we found out that he was healthy enough to be put on the transplant, list. So then after that, they started scheduling me to have, like my lungs tested, my heart tested. I had to do EKGs, I had to do stress tests. They did numerous blood tests to make sure that I was healthy myself. But the biggest thing that had to match also is what they call cross-matching. That has something to do with your antigens and all of that. So what happens with the cross-matching, if your cross-matching is positive, that means that the blood reacts like oil and vinegar. It doesn't get along, it starts to separate. But my living donor, she called me and she said, Roxyette, your cross-matching was negative and you are good to go.
Wow.
And so again, I was hollering and praising the Lord about that.
And what were you doing, Mr. Farrington, while she was?
I was talking about when she was.
When you found out everything was good, you could go.
Ready to go.
You were ready to go. Ready to go.
Yeah.
Was there any worry? One of the things, and some of the information that we share, the Community Health Coalition, is information that dispels or debunks myths about organ donation. And one of the myths is this fear that, well, I may not get the organ that I'm in line to get. Were there any fears? There are other myths like, if I sign up and if I'm an organ donor and I get sick, then they're going to kill me off so that they can get my organ. These are all myths, unfortunately, that people still believe, that keeps African Americans waiting the longest to receive an organ because we just don't sign up because of these myths and others. when you found, were you afraid for her? Did you want her to do it? Were you hesitant? Did you say, no, baby, don't do it? Or how did you feel? What was your response?
We was on the same page.
Y'all were on the same page.
And another thing I'll add to what she just said, when a person like myself that given, going to be given a kidney, person like me, my insurance pays for hers.
Okay.
So a person doesn't have to worry about
The cost.
the cost.
Okay. But you weren't afraid like that
Yep.
she would suffer some health complications and it wasn't the worth.
No.
Okay.
No. But one thing I did when we had the surgery, I told her, I prayed about it, and I asked the Lord if anything should happen, let it be me and not her.
And he did tell me that. And with me, I didn't have any fear at all. My biggest fear was losing him because he would have to wait to get a match for a kidney transplant. So I was very happy. I had no fears at all because I felt like the Lord had predestined me to give my husband a kidney. And like one of our church members came by after we found out that we were going to be able to do it. And they said, do you know that God put y'all together just for this purpose?
Isn't that amazing?
It's just so amazing, And I said, Lord, please don't allow him to have to go on dialysis because dialysis is good, but it has a lot of side effects as well. And so I was just happy about God blessing me to be a donor to my husband. That was one of the best things for me. I didn't worry about any side effects for me. I just wanted to help my husband because I knew that if the situation was reversed, that he would do the exact same thing for me.
Speaking of the side effects, so I do want to ask, what were some of the complications or, if any, and challenges that you faced through the process?
Well, there was one problem that happened with me actually when we had gone in to have the kidney transplant. The actual kidney transplant was supposed to be shorter hours. But then when they went in and opened me up and everything, they found out that my arteries and veins was wrapped around the kidney. It wasn't really easy to get to. So they had to go in there and be very careful to move my kidney out without damaging the arteries and veins that had to be taken out to be attached to my husband. So he was a little worried about that because, of course, they took me first, and then he had to wait. So he had to wait in the I guess, the waiting room, and he was a little worried about what's going on. And so then they came down and told him, and then they took him up, and so everything went well after they got that situated. And then the day of the actual transplant, I think that I was more lethargic and under medication than Dennis. I was told that, and he can tell what he was doing while I was down there in pain.
Right. So you mentioned cost also. So one of the fears or one of the concerns that we found through research and just getting feedback from members of the African American community, and particularly, which is where we've done quite a bit of our work at the Community Health Coalition, is cost. People will say, well, I can't afford it. And you said that your insurance covered it. Without going into the numbers, was there any cost that you all had to incur yourself?
My insurance.
Covered everything. Medicine, everything.
And the only thing with me, each time that I would come in, they asked me not to share my insurance. So when I was admitted to the hospital and was coming through the process, they took my insurance company out of it, so that everything would be charged to his, insurance company. Now, of course, the other thing that you have to do, you have to be approved to have the kidney transplant.
Okay.
So you have to talk to financial people as well as psychologists, because, a lot of times they think about that it's a burden and people might, have some type of reaction after they lose a kidney or whatever. And then they talked about our relationship, to make sure that we were on the same page. They talked about just making sure that this is what we wanted to do. And so, you know, I was very adamant that I was going to do that. And another reason, I just didn't want to have to ask any of the family members, meaning his siblings and my children. So I would have felt really bad if I knew that I hadn't done everything that I could do to try to save my husband's life. So it started with me.
With you.
Yes.
Are there any important lessons that you learned that you learned along the way that can help other families who are considering the same thing, who has a family member that is on the donor registry? What can you tell other family members or other people to help make the decision about whether or not they should sign up and register, become on the donor registry, and consider helping out someone who's in need? What are some things?
Well, the thing that I would recommend is that, when you find out that one of your loved ones, is sick, that you will research the illness. And I also would suggest that you be in tune with your partner, like my husband, in tune with his health, because that when he has appointments and things like that, try to go on appointments and try to, be a part of what's actually going on in his life so that you can be informed. And then if you have questions, don't be afraid to ask questions, because there's no, stupid question. Because Dennis, when he actually had the transplant, he was on 40 medications. He was on 40 medications, of course, immunosuppressants. He was on steroids. He was on medication to keep you from having viral infections or getting infections. And so it was a challenge for me to learn all those medications and to make sure that they were properly put in his little bin. I had a little container for Monday, Tuesday through, the next week. And I would count, and just to make sure, because a lot of those medications, especially in the first 6 months of life, could be detrimental to him if he were to have an overdose. So that was a challenge for me, but with the help and grace of God and family, I was able to get through that. And so I would just tell the person to be diligent. If it's in your heart to do anything to help someone, just do it. Just pray about it and do it. And sometimes you may run into persons that may not have the same thought pattern as you do, and may have fears or myth, or have read these fears and myths, and they may say, well, I'm not going to do it. But I just truly believe that since I'm a strong woman of faith, I believe that the Lord was going to bless me to help my husband with the kidney. So.
And Mr. Farrington, if you could talk to someone about this precious gift of life that was given to you and what it has meant to you, what would you say? What do you want to tell people why this was so important, or what it has meant to you?
Well, I would tell them, being a donor is a gift of life to help someone else. It's no more than you have a bunch of clothes, things at home that you want to get rid of, that you take to the Goodwill. It's the same thing, but just on a different level. You're helping somebody.
Right.
And we should all want to help someone else.
That's right.
For the simple reason I say this is because you don't know what you're going to need and who you're going to need. You might be all right now.
Right.
But later you don't know how you're going to be and who you're going to need.
That's right.
And families should be close. I found out a lot of families are not close. Somebody gets sick, and the one you've been fussing and fighting with could be somebody that could help you.
The very one that saved your life.
Yeah.
Very good. Yes.
And then I just wanted to add that I think that when people consider doing donations, either it be the kidneys or whatever organ or bone marrow or whatever, I think that you should really think about it. Just suppose that was one of your siblings or whatever that needed a kidney or whatever kind of organ. and you have tried and waited and waited, and your loved one had to die because no one actually gave your loved one a kidney. How would you feel if your sister, brother, mother, or somebody died because no one gave them a kidney? So I think that you should put, like my husband just said, that we don't know what this life is going to bring. And suppose that your family member needed an organ and they died because no one gave. So it's like giving back and putting yourself in a situation.
Right.
And I just am thankful that I was healthy enough to give my husband a kidney. You know, one thing that I can also add is to make sure that you take care of yourself, you know, eat healthy, be mindful of what you put in your bodies. Don't smoke because, of course, that could cause other issues. You know, watch your cholesterol and your blood pressure, because when you have problems with your kidneys automatically increase your blood pressure and your cholesterol. So just be mindful of what you're putting in your body, because like when Dennis and I was married or was courting or whatever, many years in the young ages, I would have never fathomed or dreamed that I would be giving my husband a kidney. Right. But I'm just so thankful to the Lord that I was mindful enough to just take care of myself so that when that day came that I could help him.
This has been such a joy and so informative, and I so believe and trust that it will indeed, your story will help encourage others to do the same, to give the precious gift of life, and especially those that are sitting on the fence who aren't sure or wasn't sure up in seeing this show. And so I want to thank you. God bless you both. Thank you. And I'm so glad you're here. I'm so glad that you're here. How do you feel, by the way? How's your health? How do you feel?
Well, I'm fine, you know, I'm fine. Like I said, I just drink water like him, and I just try to eat well and try to take care of myself.
So you haven't stopped doing, you're still going on. You're still going. So for those who think if I give my kidney, my life is going to change drastically, my health is going to be in serious decline, you are living witness and a living testimony that it works, and it works for your good. So I want to thank our viewing audience for watching our show, and we encourage you and invite you to continue to watch the Community Health Coalition on the People's Channel as we continue to have community discussions about health, and with the hopes that we can improve health outcomes, especially in the African American community and among other ethnic minority groups, as well as those who are living in poverty or who are living with challenges that may not allow them to be able to have access to certain things to improve their health. One thing that we do know can improve your health is the way you manage your health and the way in which you approach things and you view life. And if you always view it as you are on the winning side and not the losing side, no matter what it is, that you're on the healthy side. If you speak health and you believe health and you practice health, then you will be healthy and you will reap the benefits of such behaviors and beliefs. Go to our website, www.chealthc.org, to find out more about organ donation, how you can sign up to be an organ donor, to read through some of the myths that we have dispelled and debunked, to learn more. Mrs. Farrington mentioned something that is extremely important, and that is to do the research, to become knowledgeable and informed yourself about whatever your health condition is. We choose life for you at the Community Health Coalition, and we always say that a healthy community includes you. Thank you. Thank you for tuning in and watching our program. We hope that you found the information helpful.
Knowledge is power, and there's power in prevention, and you have power. So learn your ABCs, the A1C, blood pressure, and cholesterol.
And if you'd like to find out more information about our programs and services or ways that you can live a healthier lifestyle, visit our website at www.chealthc.org. You can follow us on Twitter and like us on Facebook. And remember,
a healthy community includes you.